It's a call that's telling me I'm here to serve. It's a need to make a difference in the world. 24 hours, day or night, these healing hands will make it right. Looking in their eyes, I know that I'm changing lives, changing lives, changing lives for the better, changing lives.
Hello everyone, I'm Grace Sells along with Jim Knox, and welcome back for another edition of Best Docs Network, the show that's featuring some of the best doctors in the Dallas-Fort Worth area that are really changing people's lives.
That is exactly right, Grace, and we're going to kick off today's show with pain management specialist Dr. Jason Williams, who strives to have a family-oriented practice who helps his patients be completely pain-free.
When a patient comes into the clinic, I want them to feel very welcome. I want to have a clinic that's a nice, warm, inviting atmosphere. I want to treat them as I would a family member, my own family member. The first person they see is Sonia. She's the receptionist, office manager, kind of the patient go-to person for any needs that they might have. She's always makes it a point to welcome every patient, make them feel invited, make them feel comfortable, and let them know that she's there for anything outside of the medical treatments that the patients might need.
We really do like to get to know our patients as much as possible on a more personal level so we can individualize their treatment plan and help them in any kind of recovery process in order for them to be pain-free and make it as smooth as possible.
The second person that a patient meets is my nurse, Kelly. She's very instrumental in the treatment process for me. And then she's very instrumental in the backside of things, and so is Sonia. Kelly's very instrumental in the post-operative or the post-treatment plans. She's pretty much the go-to person to talk to when patients have any issues whatsoever post-operatively.
Through my professional experience, I'm trained to care for all of his patients in the pre-op and the post-operative setting by providing education and what to expect during their visit, during their surgeries, and then also in their post-operative care. Initially, when I meet with Dr. Williams' patients, I review their history, their major complaints on why they've chosen to come to Dr. Williams in order to provide the absolute best information that I can for Dr. Williams to perform the surgery.
When patients come in, they may have a lot of questions about their pain and treatment options, and we are always here to answer any questions that they have.
From the moment a patient walks in my door and they meet me, I want them to understand that I'm going to take the time, do what it takes to get them from the point they are when they meet me to a point where they're 100% pain-free, no matter how long it takes.
BestDocsNetwork.com helps you find the right doctor for your medical needs. Watch videos on each doctor and decide for yourself who fits you best. On the Best Docs Network homepage, you can see the latest videos, search for a doctor, find educational content, and watch the latest TV episodes from each BDN market.
Gynecomastia is a very important part of our practice that I enjoy doing. Gyneco means woman-like, and mastia means breast or chest, so it's a woman-like breast. On a man, that means not just necessarily obesity, but also the glandular tissue that comes along with it, which is the hard, fibrous area that you can actually feel under the nipple and the areola. We see many young men who get it with the onset of puberty, and then we see many men in their 20s, 30s, and 40s who have no antecedent cause for this. Gynecomastia surgery traditionally has not been a very satisfying operation for either the surgeon or the patient. And the reason why is 99% of surgeons are still doing the same technique that's been done for the last 80 years. They put the patient to sleep, they make a 3 o'clock to 9 o'clock incision around the areola, they start cutting out the tissue under direct vision, then it starts bleeding, they can't see very well, they may get a contour problem or a depression, and then ultimately they put drainage tubes in from the side to drain out the fluid. So about 9 years ago, I came up with a new idea. No scar at all on the chest, no drainage tube. We're able to remove the two components of gynecomastia, the fatty tissue and the glandular tissue, through an incision this long under each arm. And there are two instruments that allow us to do it. It's the use of ultrasonic liposuction, and we have a multi-jointed cutting device. We're able to cut out the rest of the glandular tissue with an instrument that goes through this incision all the way down to the nipple. After we've cut all it out and it's perfectly flat, the last thing we do before closing the incisions is to re-inject the entire field with a long-acting anesthetic called Marcaine. So when the patient gets up, we've already got the compressive garment on, they're pain-free. They're typically only in the recovery in 45 minutes to an hour, and that stays numb till the next day. They wear the compressive garment under their street clothes for 3 weeks, and they're done. We see them at 8 to 10 days post-op, or we see them 6 weeks after that, 3 months after that, and they're delighted.
Developing a long-term relationship with your doctor is top priority when trying to achieve your weight loss needs. It's important that you have a doctor that helps you track your progress along the way. Up next, we see how Vicki did just that after losing 85 pounds with help from minimally invasive, general, and bariatric surgeon, Dr. Preeti Malladi.
I decided to enter the field of bariatric surgery and focus my practice and also become specially trained in this field because it has such a profound impact on patients' lives. Patients have been struggling for years with multiple medical conditions and sometimes even low self-esteem, and when they come to my office, I can offer something that really can be successful for them.
I decided to have the sleeve procedure when I got tired of being tired and not feeling good. With me being overweight all my life, I had a doctor tell me one time, he said, Vicki, your knees were not designed to carry what you are making them and have made them carry your whole life. Before I had the surgery, it was always hard going on vacations because walking anywhere, I can remember a few years ago, I went on a trip to New York with my daughter and I thought I was going to die. Needless to say, I was always the straggler. We did everything through the subway, up and down the stairs. It was horrible.
So it's really exciting to work with patients and then perform surgery and also work with them for their lifestyle change and then see the changes happen. And the great thing about bariatric surgery is that I have a lifelong relationship with patients. I see them post-operatively, I see them for years afterwards, so I can see how they're doing in the short term and in the long term, and see them come off their medications, see them lose weight, see them gain energy and feel great about themselves. And the most important thing is that they're able to live longer, have a better quality of life in the end, and be able to enjoy that with their families.
Dr. Malladi, I just can't say enough good things about her. She is a genuine person. She's a very caring person. If somebody said, we were going to shoot you if you do not say something negative about her, I'd have to go shoot me. I've lost, since I've had my surgery, 85 pounds. I feel fantastic. I feel like I look good. I just feel so much better. I feel alive.
Coming up next, we'll find out the difference between Alzheimer's and dementia during our Medical Minute.
Plus, how to exercise your ears to hear better when you're older. This and much more when we return.
Best Docs Network doctor and official eye doctor to the Dallas Cowboys, Dr. Harvey Carter, the expert for all your vision needs. See the world differently in only a day. Specializing in LASIK, cataracts, and crystal lens. Visit Dr. Carter today for the ultimate eye experience. Call now and receive $2,000 off your LASIK procedure. When seeing is believing. Dr. Harvey Carter, the official eye doctor to the Dallas Cowboys.
Imagine designing your own perfect face and body. Turn to Dr. Robert Wilcox, who specializes in face and body procedures, as well as many non-surgical alternatives. Dr. Wilcox understands that your life and appearance matter most. With an extensive educational background and exceptional eye for detail, you can now look as young as you feel. Call for a complimentary consultation and regain your confidence today.
Traditional MRIs cost a fortune and are uncomfortable, usually done in small, cold hospital rooms. But you have a choice. You can have your imaging done at Preferred Imaging in a comfortable environment with superior staff and technicians that make it simple and stress-free. Even better, Preferred MRI costs 2/3 less than the traditional hospital MRIs. And with 18 state-of-the-art locations, it's easy to find one near you. Call now to find out how you can save on any of your imaging needs. Preferred Imaging. Imaging made easy.
Do you have missing teeth, need crowns, veneers, partials, dentures, or a full mouth reconstruction? Prosthodontist Dr. David McFadden will give you back the youthful appearance and confidence you deserve. Backed by credibility and credentials, Dr. McFadden is cosmetically changing his patients' lives one smile at a time. Call today or log on to dignitydental.com. Dr. David McFadden, your go-to dentist in the Dallas-Fort Worth area.
To find a doctor on bestdocsnetwork.com, you can search by your location and the doctor's specialty. From there, you can search through the doctors listed. You can even search by your current location to find the doctor closest to you. If you want to have decent hearing when you're in your 90s, you can exercise your ears. Simply turn on some music and practice singling out a single instrument and listening to it. This exercise can help to hear more details in everyday sounds.
Hello everyone, we're in the studio today with one of the top facial plastic surgeons in the Dallas-Fort Worth area. It's Dr. Yadro Ducic. Thank you for joining us today.
Thank you for having me.
Of course. So you're double board certified. Tell me a little bit about what other areas you specialize in.
Well, I do a fair amount of reconstructive surgery as well, so we deal with a lot of facial trauma patients, head and neck cancer patients, skin cancer patients, and it's a lot of those folks you're removing parts of their face and then reconstructing and rebuilding them, and it really kind of flows nicely into cosmetic surgery because you're doing similar sort of things. It's all about making people feel better about their appearance and function better.
So tell me, Dr. Ducic, you have a unique philosophy, and tell me what your goal is with patients.
Well, I hope it's not too unique. I'd hope that most facial plastic and plastic surgeons felt the same way, but you know, by the time a patient comes to see you, for whatever the problem is, whether it's a crooked nose, a mole on their chin, a weak chin, loosening of skin, whatever the issue is, they've thought about it for a long time. They've looked in the mirror, they've critiqued themselves. Sometimes they've even shed a few tears. And so the last thing we need to do is to make them feel more uncomfortable about other things. And so I think it's important to address what their concerns are, recommend procedures or surgeries if they're appropriate, and reassure them that they'll do fine even if they don't have anything done. Because the most important thing you want is for them to walk out of the office feeling good about themselves. And the most important thing we want after surgery or procedures is for patients to feel good about themselves. The last thing we want is to create more anxiety by pointing out other flaws, which all of us have. That's what makes us human.
To see the rest of this interview, as well as other outstanding videos, head to bestdocsnetwork.com.
A lot of my patients worry about dementia. They think they're getting Alzheimer's disease. The main thing that worries people is they go into a room thinking they're there for something and can't remember what they're there for. That really isn't dementia. That's just being overwhelmed with life, having too much on your mind, and just generally the human condition. Dementia and Alzheimer's disease is characterized by people who sort of forget where they're going, for example. They have to call home and find out how to get home. They've gotten lost driving. Or they forget names of people, or they forget places that they're supposed to be. Pretty obvious things. Also, dementia is a progressive thing. We don't see dementia happen just a little bit here and then a little bit there and stay the same month to month and year to year. It tends to be worse and worse and worse. For example, you and your family and your friends will notice that you're worse now than you were 6 years ago, or 6 months ago even. So it's important to not worry about the small changes. It's those progressive changes where you lose your memory for things that you should remember.
For additional medical minutes from Dr. Honaker, log on to bestdocsnetwork.com and click on the Medical Minute tab on the home page.
Don't forget, for more information about any of our outstanding doctors, the place to go, Grace, of course, the website, bestdocsnetwork.com. That's bestdocsnetwork.com. Right now, the place to go is our next best doctor, who gave one man back his youthful appearance.
That's absolutely right, Jim. Plastic surgeon Dr. David Azouz helped John regain his confidence to re-enter the dating scene after receiving a male facelift.
I never intended to have a facelift. However, I had married a gal for several years, and during those time I gave her lots of plastic surgeries. And then I found out that she had, after she left, she actually got remarried, and a fellow showed me her picture on Facebook. And she looked, at 55, she looked absolutely wonderful. Just really good. And I thought to myself, you know, if I could pay the money for the plastic surgeries for her, I bet you have enough money to pay for it for myself.
John is a very intelligent gentleman who was close to 70 years of age, and he wanted facial rejuvenation surgery, but he wanted a very natural look. He didn't really want to necessarily look that much younger. He wanted to look rested, and he wanted to look good, and that's what he was after, which was very realistic for a gentleman who's close to 70 years of age.
It is unfortunate that more men do not choose to get a facelift because it makes a tremendous difference in their appearance. They get their chin back, they get all the wrinkles taken out of their face, and they look younger, and obviously they're going to have more respect when they're younger.
There's many actors and other prominent figures in our community where the males have had facelifts, and they look like they've had a facelift. They have almost an unnatural look. In a gentleman, you have to be extremely careful because if you make him unnatural, you tend to feminize him. And I think the last thing a male wants is feminization of the face. They just want rejuvenation of the face. So I believe that we were able to achieve all that, yet giving him a very natural look to the point that he doesn't look like he's had facial rejuvenation surgery.
The surgery has given me a confidence to put myself on some of the dating services, the .coms. And the results have been excellent. I've probably had a different date at least once a week, maybe sometimes twice a week. And the number of people responding to me, I realized that they were younger and younger and younger. And typically the people that respond to me are aged somewhere between 50 and 55. And that's not bad for somebody 68. I'm very, very pleased with that.
Still to come, Pauline learned key facts on treating a diabetic ulcer on her foot.
Plus, Kayla was able to reconstruct her asymmetrical breast in a one-step reconstruction procedure. All this when we return.
Best Docs Network doctor and official eye doctor to the Dallas Cowboys, Dr. Harvey Carter, the expert for all your vision needs. See the world differently in only a day. Specializing in LASIK, cataracts, and crystal lens. Visit Dr. Carter today for the ultimate eye experience. Call now and receive $2,000 off your LASIK procedure. When seeing is believing. Dr. Harvey Carter, the official eye doctor to the Dallas Cowboys.
Imagine designing your own perfect face and body. Turn to Dr. Robert Wilcox, who specializes in face and body procedures as well as many non-surgical alternatives. Dr. Wilcox understands that your life and appearance matter most. With an extensive educational background and exceptional eye for detail, you can now look as young as you feel. Call for a complimentary consultation and regain your confidence today.
Traditional MRIs cost a fortune and are uncomfortable, usually done in small, cold hospital rooms. But you have a choice. You can have your imaging done at Preferred Imaging in a comfortable environment with superior staff and technicians that make it simple and stress-free. Even better, Preferred MRI costs 2/3 less than the traditional hospital MRIs. And with 18 state-of-the-art locations, it's easy to find one near you. Call now to find out how you can save on any of your imaging needs. Preferred Imaging. Imaging made easy.
Do you have missing teeth, need crowns, veneers, partials, dentures, or a full mouth reconstruction? Prosthodontist Dr. David McFadden will give you back the youthful appearance and confidence you deserve. Backed by credibility and credentials, Dr. McFadden is cosmetically changing his patients' lives one smile at a time. Call today or log on to dignitydental.com. Dr. David McFadden, your go-to dentist in the Dallas-Fort Worth area.
Each doctor on the Best Docs Network website has their own profile page where you can watch videos on the doctor, read info on their background and training, find their office locations and directions, as well as ask the doctor a question and request an appointment.
I didn't have Poland syndrome, but it was like it, where one breast is significantly bigger than the other. So I was like a B and a C. It affects everything. The way you dress, the way your wardrobe is, the things you can and can't buy. And as a woman, you want to be able to just go buy it because you like it and you want to wear it, not because of the way it's shaped or formed around your breast area. I just got tired of feeling like that, and I knew that after having a child, it still didn't change. I finally said enough is enough, and I went and saw Dr. Barnett.
Kayla was a special case. This was actually more of a reconstruction than it was simple augmentation. There was nothing simple about that case. She had vast asymmetry in the breast. Asymmetry means one's not the same size or shape as the other. In Kayla's case, this one never developed. And this one was what you'd call a tube sock. Elongated, hanging down. This one was barely there. Usually should have been a two-stage operation. And I told her going in that, I can do so much, but probably you're going to need another operation.
We talked about it and looked at the pictures, and the kind of surgery I needed and required with what I had should have been a 2-step, possibly 3-step operation. And what Dr. Barnett did was just a 1-step operation. And that's all it took.
I was able to, in one stage, create a matched pair. It worked out beautifully. It's been a year now, and she looks fabulous, and she's happy as a clam. Is it rewarding? Yeah, really is. That's a special case.
Dr. Barnett treats his patients like family. He will give you his cell phone number to make sure that you can always be in contact with him. If you ever need anything before and after surgery, I'm happy and glad to know that I safely chose him. I've had no complications. You can't even see my scars. He changed my life forever. It was the best decision I ever made.
How would you like to have a facelift without going under the knife? Well, in our next story, one lady did just that, thanks to Dr. Naila Malik.
Aging is a multidimensional process which starts in the surface and involves subsurface structures, including skin, fat, muscle, and bone. So the way we determine the best treatment for anybody's aging face is by looking at the extent of aging they have in each one of those layers. The CO2 laser will address your skin surface problems like texture and fine lines and deep lines and some collagen elastin production. The radio frequency will address the skin tightness below the skin, and then you can use dermal fillers such as Radiesse or hyaluronic acid fillers to account for the loss of fat that occurs with aging as well. It is important to know what your patient needs based on their face shape and the type of aging you have. When I saw Jennifer, she originally came in asking for an option of a filler for her fine lines and deep lines above the lip and nasolabial folds. But after examining her, I determined that the CO2 fractional laser was probably the best choice for her. And she had the added advantage of having a tremendously great response to the CO2 laser by improving her elasticity.
My only knowledge of cosmetic procedures was filler and Botox. And I was told that I would probably need a facelift a few years ago by someone else, and I was dreading the thought of going under the knife, and that wasn't for me. So I was very thrilled when she told me this is basically a facelift. And sure enough, I had it 5 days ago, and I am absolutely thrilled with the results. And what's even more exciting, she says the results are even better as you go a few months down the road. So I'll continue to see improvement. I am completely blown away that for as simple of a procedure that it has completely changed my life.
The response of each individual patient to these treatments is very, very different. It depends on their genetics, on their lifestyle, and so many other things, the amount of stress they may have at that time. So you cannot really have a cookbook that every patient is going to need the CO2, radiofrequency, and dermal fillers, even if they look the same at the first visit. So you really have to step back and look at their results and see how the results show up over the next several weeks before you decide to do a second treatment.
BestDocsNetwork.com also has a video library of all the doctors' videos that you can break down by doctor, topic, and specialty. This is a great way to find videos quickly and watch all the videos associated with your needs.
Hi, I'm Dr. Preeti Malladi with Best Docs Network. Did you know that obesity can increase your risk of sleep apnea and that bariatric surgery can help? To learn more, watch my videos on BestDocsNetwork.com.
Diabetes is a systemic disease that affects multiple organ systems, and in particular, it affects the feet. The main complication that occurs with diabetes is something called neuropathy, which is where the patient loses the sensation in their feet. Once that occurs, they are at risk for pressure calluses, ulcerations, infection, and possible amputation.
At the end of November, I developed a blister on the bottom of my foot that then turned into a diabetic ulcer, which then caused an infection in my bone, primarily my big toe, and had to have my big toe extracted.
A lot of people don't realize that there are over 75,000 diabetic foot amputations a year. Of those diabetic patients that have amputations, 68% have a 5-year mortality rate.
Pauline came in, and because the diabetes was so out of control, her ability to heal these pressure ulcers on her feet were severely limited, and that's one of the main problems with being diabetic is your ability to heal common ulcers or pressure areas.
I didn't realize how bad it was, and it can just come on you, and if you don't get it taken care of, then it will lead to not just toes, but your feet and your ankles and your legs.
Another thing that diabetics are prone to is peripheral artery disease. This is poor circulation in the extremities. We have modalities here in the office that we can help assess for these risk factors. For example, we have a peripheral artery test that puts blood pressure cuffs around your arms and legs, and what it does is assess the amount of blood flow that's getting to your extremities. By this, we can help determine whether there is further intervention that's needed. So if you do end up having a sore on your foot, we can address it and it will heal properly.
We are now seeing Pauline much more frequently for regular checkups and providing special shoes and inserts as well to prevent further pressure areas from developing.
I'm feeling stronger, and finally I'm getting to the point where it really is important to take care of it.
That's going to wrap up today's episode of Best Docs Network, the show that's featuring some of the best doctors in the Dallas-Fort Worth area. And remember, if you have a question, a comment, or a life-changing story of your own, just send us an email at info@bestdocsnetwork.com.
Also, for those who want to see all our outstanding doctors, if you missed anything on today's program, head to the website, bestdocsnetwork.com. That's bestdocsnetwork.com. So long, everyone. We will see you next week.